When the pandemic hit in March 2020, it was clear we had been thrust into a completely novel crisis.
COVID-19 cases climb.
And novel crises demand novel responses. Creative Destruction Lab quickly convened a vision council of business leaders and thought leaders to determine how we could accelerate the world's economic recovery from COVID-19. One solution kept surfacing from the Vision Council's conversations: a comprehensive workplace rapid testing program that would identify asymptomatic individuals, break chains of transmission, and help employees safely return to their jobs. A small group of CEOs decided to take action, and in August 2020, the CDL Rapid Screening Consortium was born.
The vision for a Creative Destruction Lab rapid screening program was to help reopen the economy. And the way we would do that would be to solve the information problem. And what we determined was the fastest, cheapest, most efficient way to solve the information problem was through using rapid antigen testing.
In order for companies to get their rapid screening program up and running fast, CDL RSC developed a playbook that included everything, from consent forms to training materials to a privacy-compliant data system.
Healthcare organizations like ours struggled a lot during the pandemic. We weren't the first people to be on the list for gloves and gowns. And so to be on the list for rapid screening and to be able to offer that as a sense of safety for our staff really contributed a lot to morale. And we really felt that we were a priority for CDL.
As the consortium grew from the 12 founding members to include hundreds and then thousands of new companies, a buddy system paired incoming organizations with a mentor to get them up to speed.
So the Ottawa Birth and Wellness Centre was originally paired with Air Canada. And as a small organization, you can imagine we were thinking they're quite big and we're quite small. And early on, my reaction was that it was too overwhelming and it was going to be too hard for us to get involved. But Brigitte reminded us that there are 3 simple steps: getting on board, doing the swab, and reporting it. And when it was brought down to that level, we were able to get it going.
So the impact of self-administered, of course, was one, we didn't have to use nurses and doctors. They were able to work in hospitals and long-term care homes. The other impact is our employees who were able to do it themselves. We were able to scale very quickly and then move to home screening because our employees knew what to do.
Regular town hall meetings with the companies encouraged openness, collaboration, and the development of best practices. At a time when so many of us risked feeling isolated, these sessions provided a community for everybody to take part.
The town halls were a great source of information. We were all dealing in isolation with COVID, and it was a way that we could collaborate with the community outside our company. It was a wealth of sharing, a wealth of knowledge, and it was a true community in which we all helped each other share our learnings, our problems, and help solve each other's problems too.
Ultimately, CDL Rapid Screening Consortium created, to our knowledge, the largest data set for rapid antigen testing in the world. And the insights we gathered from this data had a meaningful impact to support the evolution of government policy with implications for the health and safety of Canadians at large. These data were used to publish multiple peer-reviewed scientific publications to contribute to the global community's knowledge on how to better manage COVID and future pandemics. One of these papers, published in one of the most prestigious medical journals in the world, the Journal of the American Medical Association, was the most frequently viewed article from that journal in all of 2022.
So the CDL RSC program really helped to provide data and facts to both the federal government and some of the provincial health authorities that testing asymptomatic individuals was truly beneficial.
As an energy company, it's really important to provide a stable source of energy for Canada. It's the size of operation that you cannot start up and shut down at a whim. The rapid screens were a key part of keeping our people safe so that we can keep our operations running. We had over 400,000 screens at our Syncrude site, and even more when you consider the at-home screening.
When I was first asked to join the program, I was apprehensive because I am not a public health expert and I'm certainly not an IT expert. But very quickly realized it was the power of all the people around the table that made the difference.
Working with people from across companies and different disciplines, different sectors was very inspirational. I have studied innovation for over a quarter century. That's what I teach at the university. And nowhere have I seen something like this. This was a learning exercise for me. We've been documenting it so we can share what we learned with others.
What we learned was that collaboration is the key. If we work together, if we have one goal in mind, if we cross all of these different companies and barriers, whether it's in the aviation industry or rail or telecommunications, banking, it didn't matter. It wasn't just about learning about pandemic, it was learning about problem solving. So whatever the problem is going forward, this is a model that we can use.
I think it really did show me that big organizations and small organizations can come together in a crisis. We know that sometimes things don't really cross over and sometimes we don't get to connect in a way that we should. But when we're all fighting for the same thing, I think that's truly magical. And I think this demonstrated that we can come together to move things forward as a community.
As of March 31st, 2022, CDL RSC had grown from 8 to 12 to over 2,000 participating organizations. This included large corporations, small businesses, schools, and not-for-profits. The CDL RSC community deployed over 2.3 million screens and captured thousands of presumptive positive cases, helping break chains of transmission in the workplace.